it is time to open the meeting for the Board of Health. Can I have a motion to open the meeting?
Make a motion to open the meeting.
I'll second it. And we're going to do roll call vote to open the meeting. Diane?
Here.
You'll say yes.
Yes.
Kim, yes. We are now opening the meeting. Oh. Oh, wait, I did the wrong one. Public hearing.
Oh, you're not listening.
Here it is. As a preliminary matter, this is Kim Mu-Chow. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Vice Chair Jeff Harris is not here today. Member Diane Daddario.
Yes.
Kim Mu-Chow Chair is here. Staff, when I call your name, please respond in the affirmative. Health Director Kathleen.
Yes.
Health Agent Ginny.
Here.
Public Health Nurse Alicia.
Here.
And Regional Inspector Carey is at a meeting. And Permitting Specialist Melanie is not here as well. And then we also have Steve Sherlock from Franklin TV attending as well. Citizens' comments. Citizens are welcome to express their views for up to 3 minutes on a matter that is not on the agenda in compliance with GL Chapter 30A, Section 20. The open meeting law, the Board of Health cannot engage in a dialogue or comment on a matter raised during citizen comments. The Board of Health may ask the Director of Public Health to review the matter. Are there any citizen comments? There are none. All right, so we have minutes from January 7th, 2026. I make a motion to approve the minutes. I'll have to second it.
I'll second it.
All those in favor, Diane? Yes?
Yes.
Kim? Yes. The minutes are approved. Thank you for doing the minutes. And then now we're moving on to new business, and exciting that we're going to be looking to do a Women's Health Expo.
Yeah, actually, so Alicia and I were brainstorming what we wanted to do in 2026, something meaningful, not a spring health fair, but at the library. So we thought, you know, the baby shower that was held in Rentham didn't get a real good turnout. And I kind of wanted more of a focus on women a little younger, 30s, 40s, 50s, and older. So we started brainstorming. We reached out to New England Chapel. We can use the facility. We reached out to a mobile mammogram van. We're still waiting to hear back from them as to lock down a date.
Yeah.
Which the New England Chapel parking lot would be really conducive. And we started a spreadsheet of the vendors that we want to invite, a little different than the health fair. You know, we would want to, everything from, you know, perimenopause to postmenopause to dementia, you know, all women subject. And I think that's super important because we all experience something at some point in our life, and I'd like to hit home on that. Maybe even a little maternal health as well.
Yeah.
Yeah.
So we're in the beginning stages, but we're looking at the.
We're looking to start planning. It's hard to try to reach out to people yet until we have a date confirmed, and that's basically being held up until we get confirmation from the van before we can start inviting vendors for it.
And those mammograms are free, and so that's what.
Yeah.
Yeah. So that's why I like to.
Yep.
Yeah.
Yeah, they're the only ones in the state that have it. So I'm just
good.
waiting to hear back. Yeah.
Yeah, and I'd like to kind of know if I think 50 is the time where you can start having mammograms.
No, it's
Is
40.
Is it 40?
40,
Yeah, so I'd
yeah.
like to really kind of.
But I think they won't turn
Depends
people
on your-
away too if they
does.
have like elevated risk factors.
Depends
You know
on
what
your
I
family
mean?
history,
Exactly.
just
So I don't think if someone was like 30 years old and their mother died of breast cancer that they would be turned away. They'd probably be a perfect candidate for it. And
Yeah.
a lot of people, women in general, we tend to, I don't want to say like neglect ourselves, but it's just like a good reminder like, hey, if you haven't gotten this done yet and need to get one, or you're due for one and your doctor's office is out in Boston, it could be a perfect opportunity,
Yeah.
especially even with the, you know, lack of doctors. It's hard for people to find primary care providers and things like that. So it'll be a good resource for people.
Yeah, so and we usually get a good turnout for our events.
Yes,
So
yeah.
I'm pretty excited about it, to be honest with you.
Yeah, we're
So-
just a little stalled right now, just waiting to hear.
Yeah, I started the spreadsheet. I
Okay.
think I came up with like 10 or 15 vendors,
nice.
you know.
Yeah.
Typical gym, right?
Yep.
You know, to yoga, to Reiki, to all the things. So, but if you have any input too, let me know, because
Mhm.
we're always open to something new. So
Yeah.
I'm very excited about it, and I will keep you updated.
Are you thinking of doing it like in the late afternoon? Only because I'm thinking like some women may be working.
That's, yeah, probably like a 3 to 5:30, like what we usually do. That way you can try to get people out of work.
Yeah, or 3:35, depends
Or
on the
3:30
van.
to 5, yeah.
It depends on the van too. We don't
That
know what
too.
their hours are, but we typically hold our events on Wednesday late afternoon because we work late.
That's our work, yeah.
And I mean, the health fair, we get over 400, sometimes 600 people.
We
go
have gotten a
through,
good
so-
amount of people. I think a lot of it is like weather dependent and what's going on. Like I remember we did one health fair, it was like the week after daylight savings.
Yeah. boop.
And that was rough. And then we've had like we've had like over 500 people come to them, so.
Oh, good.
Yeah, so I'll
So-
keep you updated. Oh, go ahead.
If you have choices of dates, the third, and you want Wednesdays, the third or fourth Wednesday of the month is probably good.
Better, okay.
Because the sanctuary is being used for worship night practice on the first
Okay.
Wednesday and for worship night on the second.
Perfect.
So it just makes it a little easier if you're not doing it in conflict with something that's already going on in
Okay.
the same space.
Yeah, that's
No,
good.
if we can narrow it down and see, I think some of the problem too is they didn't have like their May schedule out yet, so it was,
But now we can narrow it down.
yes.
And I don't even
Thank
care
you.
if we do it in June.
I was just gonna say that, like whatever,
Yeah.
we'll throw out those dates and plan it.
All right, great.
Excellent. May or June. All right, so then I thought that we would have, because
Thank you.
the American Academy of Pediatrics came out with their most recent vaccinations. The CDC came out with theirs, which are very different. Massachusetts has joined the Northeast States Consortium and they're really going with the American Academy of Pediatrics. But I thought we could have a brief discussion in terms of that, who we would endorse, which I'm assuming that we would endorse the state, which is. So, thoughts from you in terms of the changes that were made by the federal government and our state's decision to follow the established guidelines set.
And I think we should still, I mean.
Yeah, I can, so I have like a little
support
tidbit.
vaccination.
Yeah,
Yeah.
on my thing at the end of it, because basically in response to all the changes that have been made to the CDC in the pediatric immunization schedule, the Massachusetts Department of Public Health has recommended that providers in the state instead follow the immunization schedule of the American Academy of Pediatrics. So on January 26th, the American Academy of Pediatrics released its updated 2026 immunization schedule where nothing was changed, not the CDC's changes, just nothing was changed from last year. And that, you know, people should still continue to get the immunizations to protect against the 18 diseases, including RSV, Hep A, hepatitis B, rotavirus, influenza, and meningococcal, whereas what the CDC was saying was consult with your physician about those versus having them be like a recommended. That's, and Massachusetts basically said we're gonna go with the American Academy of Pediatrics recommendations.
So I think you had a sense of our vaccination rates in the area that you were looking at.
So mass.gov actually has, like if you look up school immunizations on mass.gov, you can actually look up the statistics on even specific schools in the state that are like large enough and do report. And basically Massachusetts and Norfolk County in general has something like a 97.8% vaccination rate. There's like 2.2% that are not up to date yet, and there could be a number of reasons behind that, but very high vaccination rate.
That's great.
Yes, yeah.
So the school nurses actually are the ones who reported and followed
The school
it?
nurses go through all of that stuff. Yeah, and then, you know, if a kid ever does need help, because sometimes it could be related to, who knows, but they might have to be on like a catch-up schedule. A lot of times they're really good at giving the resources for the families.
And then you see some of that when you do things at camps. How
Yeah.
does that work?
From usually from people coming from out of state, but yeah, you'll see like exemption letters, or usually people who maybe weren't born here and are more on a catch-up schedule. It's a little different, like versus our 4 polio. They have 3 because they got their 3rd one after the age of 4, and I'm just like, you know, so it can be a little different. So we check it, yeah.
Well, excellent. And I don't get the sense that we have a huge immigrant population. I know in Milford several years ago, and you probably remember when the Milford Public Schools came to the hospital in terms of they had so many immigrant children who were not immunized. And the problem was they also didn't have health insurance, and the only free clinic was in Shrewsbury once a month on Tuesdays.
St. Mary's, yeah.
And they couldn't get there and couldn't get that, and how do they get these kids into school without being immunized? So I'm glad that we don't have that issue here.
Yeah, no, I haven't heard anything from schools about issues with that.
No, and you would, because in the city that I was in, we started a clinic with my public health nurse and with immigrant students, so we could enroll them into class, and state provided vaccines. And we were open for 3 years, and we started with, I believe, 63 students and finished at over 350.
That's a lot.
Wow.
Yeah, so there are ways to address things like that.
And
we
are-
don't have that here.
We are BFC, you know,
Yeah.
we could, if there was a need, we could help fill that gap, but
There's no need.
I haven't heard any. That's a really high vaccination rate.
And through the chair, if you don't mind, we just re-enrolled in the BFC, and I wanted to, if that's okay,
Yeah.
to say, I wanted to let the both of you know that the new regulation is if we lose power to the vaccine refrigerators, up until this year, we would transport them immediately. Now, we cannot touch them. They cannot be transported. They stay in the refrigerator, and period, end. If we transport them and something happens, they expire, that's when we have, we can be fined significantly. But if they expire in the fridge during a power outage, but they were not moved, then we are in compliance.
Yep. I
So-
called the state and questioned
Oh,
it, because
good.
I was like, that's kind of
Yeah.
weird to me. Can you explain to me your reasoning behind that?
Yeah.
And they said that they were having more temperature excursions from people transporting than if people left them alone. And I was like, here's the thing. Let's say it was a Friday and it happened like before. And I knew that we weren't going to be getting power back for 3 days. And I knew Rentham, which is our backup, would have it. I would probably call the state and say, what do you want me to do? Especially because we do have a regulated cooler that's used for that. We're not using like the emergency transport of the conditioned water bottles. So,
And where we just experienced a power outage at the senior center with the generator that the vaccine refrigerators are on, so they went off. Luckily, there were no
There were
vaccines,
no vaccines, yeah.
but now that we know, I think we can breathe easier, especially if it happens on a weekend.
yeah, they just implemented that this year.
Yeah, and we have to have a backup data logger
We,
as
we
well.
did, but it,
Yeah.
it wasn't like calibrated correctly, because they said to use out the ones we have, but we just wanted to,
Yeah, we just purchased them.
yeah.
You may want to just put a sign on the,
Well, I let Sarah know, to let her staff know too, but you could put a
To
sign.
Yeah.
what, to not to touch anything?
yeah, in terms of,
Do
you know,
not.
if power goes out, we're fine, leave us alone.
Yeah, I think
Well,
just so
also
that-
too, everyone
because-
would be calling me immediately, I would hope, because they don't even know what my keys are for it.
Well, someone
Yeah,
did.
I know, because we're kind of.
Someone did unplug it and plug it into another strip, I found
That
out.
did
And
happen.
that, we would be fined thousands and thousands
Yeah,
of
that did
dollars if
happen.
there was
It
a
says right on the wall though, do not unplug.
Yeah, well,
I know,
Yeah,
I'm
but in
just,
an emergency
yeah.
that people don't
They
think,
didn't
and they
know,
just
I
kind of like
know.
try and do what's best.
Yeah.
I'll put up another sign.
panicking because the alarms were going off.
And I get it, I totally get it.
Yeah. But yeah, just so, that's an update I wanted to give you.
That's
so,
really good to know,
Yeah.
because we moved food from the senior center to other places. And I can see the excursions, if you're moving it off-site and it's in the middle of summer and 100 degrees,
Mhm.
yeah. But when it was happening here, it was probably movable, but
Yeah.
I can totally get where they come.
Yeah.
And generally, when I worked in hospitals, we would move it from one refrigerator in the pharmacy to a different refrigerator in the pharmacy.
Yeah,
and
so
so we were moving it, but we also were, it was so short period of time
Right.
to do that. Thank you for that. All right, so I think just in general that we are
Continue.
comfortable with what the state's doing and what the American Academy of Pediatrics is doing, so
Absolutely.
awesome. And then we talked about vaccines for children, update information. And then if we wanted to have a discussion on the acetaminophen and pregnant women discussion, which is kind of like on a retrospective
Mhm.
study of patients, and they had siblings and non-siblings on the Sweden one. So if you want to,
As far as when in particular, I mean, there have been no studies that show a cause and effect of a problem with using acetaminophen. As with any medication, if you use it chronically at high doses, it will cause a problem in anybody, usually.
yep.
Particularly in somebody who's pregnant, but it's not because the medication itself, it's because of the chronicity and the high dosing that could cause a problem. But again, there have been no studies. There was just some observational data, and then you need to actually start, talk about exactly what was it that they were seeing, autism and ADHD. I mean, they were just seeing these things, but that's something that we're seeing a lot of more only because we're looking for it. And testing is an awful lot better, and that's why it's, say, higher in a city, diagnosed more often because they have more resources. They're doing more testing than, say, out in the rural areas. So you have to look at all of that.
Just for minutes purposes, when you said using chronically at high doses can cause harm, should I say in a person or a pregnant person?
I think
And
in
anybody,
a person,
Anyone.
in any
but
person.
since we're talking about the pregnant person, because that is the thing that came out because somebody made a statement with little information of what he understood, and so in pregnant people, we have to also look at why is this person taking so much Tylenol. So there are other things that could possibly be going on that's causing. I mean, if there's fever and infection, and like I said, inflammation or any problem that is, is the reason why the Tylenol is being taken, that most likely is having an effect on the fetus more so than the Tylenol itself. And we nowadays, people in generally take a lot of medication that they probably don't necessarily need to take. We don't need to take, medication for every little pain that you have or for every little low-grade fever or, things like that. And so we have to just start looking at those recommendations too.
Yeah,
And that goes for everybody, but since we're specifically talking about pregnant women, we have to
And
be
people
even
may not
more
realize
careful.
it with Tylenol. Yeah.
Yeah.
Because
Or
you think of it as like a safe med, but
It's
you're not
not
supposed
a-
to take over 4 grams of
grams.
Tylenol in a day. It can cause liver failure for anyone.
correct.
Tylenol
For anyone.
is a very dangerous drug that's out there for anybody to take. You can very easily kill your liver.
Yeah.
And
It's on the
kill- and
bottle,
kill
but
yourself.
who reads every little
Very easily.
small thing on it?
Well, do
If
you
it-
want to hear just a personal note? I'm a celiac, and I was taking Tylenol for whatever, a headache, just once or twice. And I found myself a year in taking Tylenol every 4 hours because I was in so much pain until we realized that it contained gluten. It was one of the starches.
Yes.
And it was amazing. And so now, of course, they have gluten-free. But just saying that you don't
Yeah.
even realize you're just trying to stop the pain, and instead of like really kind of looking at the ingredients and things like that. But that was really a rude awakening for me. Yeah.
And the interesting thing with acetaminophen is 20 years ago, you weren't supposed to take over 7 grams of acetaminophen
Okay.
in a day
And now
because
it's
of the liver
now-
failure, and now it's down to 4.
Now it's down to 4, and I actually tell people 3.
I was going to 3
And so
with a lot of
they have
elderly.
alternate with, ibuprofen, and you have to be careful with ibuprofen. I mean, it's not going to, cause well, you can't take ibuprofen in pregnancy at all.
Correct.
That's the thing, and people are good with that. So Tylenol's really the only pain and fever reliever that we have to give to pregnant people.
Yeah, when you're sick, because like I remember when I was pregnant, they give you like a list of what you can take. It's like Tums, Claritin, Tylenol, and when you're
And even
sick,
then you
you're
shouldn't.
bumming. That's for sure.
Right.
That's funny.
So, yeah, I mean, we all, again, it brings up, this whole discussion brings up all things, well, what causes autism to begin with? And so we don't know, but we know that it's a genetic mutation. But not everybody who has that mutation necessarily has autism. So then what is the cause? So that if you take a genetic mutation and then you put like a medical or environmental insult onto that, then maybe that is what leads to it. So it's not, the thing is, we just have to be careful at just looking at a whole mess of stuff and then saying, oh my goodness, well, that's because of this or that's because of that. There are no studies. There were no studies that show cause and effect. There isn't. It's just observational. It's the same thing with vaccinations in children. There are no studies that show that it causes autism. There was that one study that came out in Germany with 12 kids and whatever, and that was refuted.
Mm-hmm.
They had to retract the entire study. It wasn't done. There was no association. But everybody grabs onto that.
Yeah.
There have been no studies to show it. And we know what happens when people don't get vaccinated, as we see. We're having a problem with measles, and something that we don't really want to have a problem with. But it's back.
That resurfaces every now and then, right? Measles. Just
Yeah.
kind
Yeah.
of cyclical.
Yeah.
But we know
Not-
now that
this
the
is
reason
them,
why
yeah.
is because there's a lot of people in the population that are not getting vaccinated for the wrong reasons. And I understand that they just want to do what's best for their kids and everything. And it is scary. And there's just so much out there. And then you have somebody that is in a position where he should be even extra careful, and he's not. And he scares everybody because he has little understanding of what's going on too. So it's sad. But I mean, I'm saying in general, Tylenol is something to be taken seriously, and doctors, I don't think, take the time sometimes to really tell people this drug can kill you. It can make you very, very sick, and so you have to take it correctly. You just don't pop it, That's the thing,
Yeah.
and that's probably what's happening with
Probably.
some of
It's
the people.
because we might be a little bit jaded about it, because like I feel like it's common that we all knew 4 grams, but you didn't know the 4 grams. Did you know the 4 grams of how
Came
much
down.
Tylenol you can take?
Well, what's 4 grams though?
1,000 milligrams.
So
I
the
don't take
problem
Tylenol.
is,
So it's like a 500 milligram tablet.
it became an issue when they came out with the extra strength Tylenol,
Yeah,
the 500.
The
I wish
500.
we would
People
have
were
just
used
stayed
to
with the
taking-
350.
Yeah, people were used to taking the 2
325,
regular
yeah,
strength.
yeah.
So, it worked. Now, you take 1,000 milligrams out of pop.
Mm-hmm.
So extra strength 1,000.
If
So
you
it's
took 2 of
500,
them.
500, so everybody takes 2. Everybody takes 2 of
Everyone
everything.
takes 2, yeah.
2 or 3, 4 Motrin. But most people will get a prescription for the 600s
Yep.
or 800s. So, and so it adds up very quickly in a 24-hour period.
Mm-hmm.
And then you get sicker than you were.
And they think, well, it's over the counter, so it's got to be safe.
Yeah.
Mm-hmm.
Oh,
Not
God.
necessarily.
Yep.
All right, well, thank you for that discussion.
Yeah,
Yeah.
that was interesting.
So, do we have the health agent report?
Yeah.
Someone-
It's in there. It's not here.
Yeah, here you go.
Yeah, so Carrie inspected 15 food establishments, 2 re-inspections, and 1 foodborne illness complaint, pre-opening inspection, and a residential kitchen inspection. And then for her conferences, she is doing the intro housing tier 3, and then she was at the training housing tier 3 last week, 2 weeks ago, and then she's at the 3rd one today. And then I guess Kim, you asked her to
Yep.
present a presentation on food inspections and trends, so she'll have that for you before you vote.
That'll be awesome. I thought that
Very
would be
exciting.
interesting in terms
Yes.
of what she finds in her inspections. It gives us
Yeah,
a
I'd
sense
like
of
to
what's
know
going
more
on.
what she does.
Awesome. I'm glad she's planning ahead.
I'm excited to learn more about that stuff too.
I know.
All right, Alicia, you're up.
Okay, so for communicable diseases, and this data, I collected it on 129, so it is subject to change. Per the Massachusetts Department of Public Health, during the week of 111 through 117, there are 1,476 confirmed COVID-19 cases and 153 probable in Massachusetts. For COVID-19 in January, we only had 19 cases versus 13 the month before. Respiratory illnesses, this is per the Massachusetts State Health Department again, from 111 to 1117, an estimated 14% of emergency department visits were related to acute respiratory disease. COVID was very low and flu was moderate. But the current estimated influenza-like illness activity is still very high for Norfolk County. I think it actually only this week dipped down to like moderate, but it's still been very high. Not just with flu, but just influenza-like illnesses.
So, I saw someplace that they had the 6th pediatric death from flu this week. Do we have a sense of, and you may not know, of the deaths that we've had from flu? Have they been non-vaccinated? Is that
I don't
part
know.
of that?
I don't know. I haven't heard anything about it.
There's no data
That's
on that,
important.
I believe.
Yeah, I would just be interesting. to-
Yeah, because like I think even with age, I only read in like one article, and I don't even know if it was like a state article. I think it was just like a news article, and this was when we only had 5. That like, oh, 2 were under the age of, but I don't know how much data they've released on it yet. And in the month of January, Franklin has had we have had 64 reported flu cases versus 147 last month. So last month seemed to be really high, and then we're dipping down a little bit. So then underneath, you can see the confirmed and suspected flu cases. So December for 25, 147, even though it goes down to like the bottom line, versus 64. Whereas last January we had 171, so we seemed to peak more in January last year, whereas it seemed to be a little bit higher in December of this flu season. And then I broke up the flu cases per age group. This is for the month of January, and still our highest age group is from the ages of 5 to 19, 33% of the people. Yes, and then the next one's probably 50 to 64 is the next largest group at 17%. Central Park Terrace, I went there for brain games on.
What are brain games?
You like that? Because we like to switch it up between, like, we do bingos, and a lot of times we'll do like Uno and other card games. It's whatever the ladies want to do. I'm down to do it with them.
What are brain games?
So just anything to kind of just help. It's like a socialization, and like with the counting and stuff like that. It's just like anything to kind of keep their
Mine's going.
Exactly. Activities like that are great for not just socialization, but even just like working it. So some people really like the bingo, but some people like to more play cards. So we just like go there and have a fun time, and we alternate with whatever they want to do.
Oh, good.
And then I do blood pressures and blood sugars after. We have a good time.
Do they eat?
Sometimes. So a lot of times the
Mobile food pantry.
Meals on Wheels, and they usually eat after we're done at noon. Yeah.
Before, They eat after you do their blood glucose first.
No, yeah, we do the sugars first and then they
And then
eat.
they eat.
And then they eat.
Okay, just wanna make
Because the
sure.
Meals on Wheels usually comes like when we're wrapping up, so it's like really good timing. Yeah. For meetings, trainings, and events, I continue to attend the bi-weekly and monthly local Board of Health webinars. I went to the FCAT, like the crisis intervention team that we do at the Franklin Police Station on the 7th. I did Narcan training with Lori from the fire station for Franklin High School administration staff on the 13th of January. I did a radon exposure and health risk training on 1/22. I did a first aid training on choking emergencies with Franklin Fire for the community on 1/28. And on 1/28, I also did a training on current events and immunizations, childhood vaccination, and high flu activity webinar, because par for the course with everything we've been talking about. I continue with my nursing care, doing Thursday office hours at the Franklin Senior Center, anything from blood pressures, blood glucose monitoring, wound care, and case management services and referrals. VFC re-enrollment is complete. We are accepted again. And you guys already heard the pediatric update about basically Massachusetts is going to stick with the American Academy of Pediatrics recommendations.
At one time, I know the senior center was asking on doing CPR and the bleed at the senior center. Did that ever happen? Or
Not again. We can, though. I know I need to train the staff and get them certified again, because I feel like we're coming up on that time, too. But, like, yeah, I'll reach out to them again.
Yeah. And
Yeah.
then just for Diane, the FCAT is a action crisis team. And we meet with the jail clinicians, Lieutenant Kalecki, Susan and Sarah from the senior center, Alicia, Ginny, and myself, Doug Parrow from the fire department. Who else am I missing? Oh, and
Carly.
Shannon from the veterans.
Yeah.
And so we take like that conversation we had this morning at the risk communication about the person. So we take that back to this table that we meet. And then we try to decide what we should do, how to approach and help this person. So there's been like severe hoarding, condemnations. There has been, it's like fire will notify me, jail clinicians will notify me. We either do everything together, we do a crisis intervention out in the field, depending on the severity of the situation, or we bring it back to the table and have just a discussion, who's gonna do what. And so we've been how long ago, ladies, 2 years now we've been doing this? I think a year and a half.
I only started, this is my third or fourth
like we've
one.
been doing it a long
I just
time.
started coming
Yeah.
into it.
So, yeah.
Amy started.
Yeah, because
Amy
Amy was,
started, the deputy town administrator
I was
started
going to
it.
say 3 years, but
Maybe 3 years,
Yeah.
yeah. So anyways, this is, it's really helpful to the
It's
community.
really helpful for us
Yeah.
to all be on the same page, because everyone has like a completely different aspect of what they can go in and do,
Yeah.
resource-wise.
Well, like in the last condemnation, hoarding, Ginny and I have been trying to get in there for 3 years. We showed up with police, had the person sectioned. I had Ginny go in and climb over on the debris and get pictures. I wore the wrong shoes. Condemnation happened, and then the steps that come next. And so it's really good.
It was actually a happy ending
A very
for
happy
that
ending.
one.
Yeah.
Actually, she's
Back
back in her place.
Yeah.
So
doing
once
well.
once
But-
you condemn a house, you can rehabilitate the house then.
Yes, that's actually in the order that they have. In most cases, it's 24 hours, which is not realistic. So then they should appeal to the board within 7 days of receiving the letter, and then you would naturally. But if it's an emergency, it's period end, you're out. Like we usually have them sectioned, and then they go to the hospital. The hospital will call, case manager will call me and say, can this person go back to their home? And it's absolutely not. And then they try to find.
How do you get into their house to get evidence that it needs to be condemned without invading their privacy?
So that's really hard. So I can't go in without their permission. However, when they open the door, that's considered a plain view inspection. So in this particular case, I noted immediately that the debris was over her head. to the side of her.
Mhm.
And then we start talking about her safety and wellness and start to kind of tell her the importance, because they can't see what we see. It's a scale. What I see is a 9, they think is a 2. They think she just thought that she had to move some mail around, and that would cure the problem.
Mhm.
And so I think at that point, when police called EMS, and they will get her ready to move her, and then she ends up allowing us to go in. Like, she kind of, in this case, it's been 3 years that she's been hiding, and I think that she really,
She gave us permission to
she
go in.
gave
I
us
didn't go
permission.
in
I
without
think she was
permission.
just
Okay.
done. Yeah, we have to. A lot of times when there's a fire and there's hoarding and police go out there and they think that we can just go in, but we can't. Even on the police or fire, we have to get permission from the tenant or the occupant or whatever. But plain view inspection is enough for me to bring it to the board. So there's 3 ways to condemn, and one is non-emergency, not sure, plain view inspection, bring it to you, and then maybe have them secure that area while they work on it, but they can still stay in their house. But most times when I get called out, then it's an emergency. And just 64 Southgate was just condemned a few months ago. She was sectioned. And then we just go from there. So, but I just wanted to give you kind of an idea what we do, and we get updates at this meeting and stuff like that. So it's a very great way to communicate with each other instead of having it all piecemeal.
Mhm.
Okay.
Yeah. So I just want to give you a heads up on that.
I think it's good that the town works together with all the different
That's-
departments, which is,
Yeah.
That's exactly what's
Really
good,
good.
is we work together, because otherwise we didn't know that the fire department was already there,
Yeah.
or, you know.
And a lot of times, and let's face it, sometimes they don't want to call the health department. They're afraid of what we'll do. And I think that Ginny and myself and Alicia have shown that we're not there to break down the back door. We're there to provide resources, try to get this person help, try to do everything we can before we have to do the worst. And it may not be like that in every town, you know.
No, but you were really
but it's like
with
that
another
here.
person that she was so good at trying to just help keep clear pathways, and you trying to explain it and how they could clear a little area, like very considerate,
Yeah.
very, very good.
And we
you
want to
know?
make sure that the EMTs get them in and out safely
Mhm.
too, so it's about public safety
Yeah.
as well, so. And I think that in the original, before I joined, it was kind of like, oh, well, don't include her till the last minute, but.
She'll just condemn it all. No,
Yeah,
I'm
she'll
kidding.
just condemn it all. It's not that easy on me. So it's turned out to be a great relationship, so that's good. And that's about it, I think.
yeah.
Future agenda items?
Well, we're gonna have the report from Carrie.
Yeah.
Mhm.
Mm.
Can you think of anything else you wanna,
No, I think
we'll leave it open for now?
And I'll update you on the expo.
Yes. That would be exciting. Would
Yeah.
you like to make a motion to adjourn?
sure. I make a motion to adjourn.
I second it. How do you vote?
And
To adjourn? Yes?
yes.
And Kim says
I'm
yes.
going to make a motion.
So we are adjourned.
We are now producing this in collaboration with Franklin TV and Franklin Public Radio. This podcast is my public service effort for Franklin, but we can't do it alone. We can always use your help. How can you help? If you can use the information that you find here, please tell your friends and neighbors. If you don't like something here, please let me know. Through this feedback loop, we can continue to make improvements. And I thank you for listening. For additional information, please visit franklinmatters.org. If you have questions or comments, you can reach me directly at suresteve@gmail.com. The music for the intro and exit was provided by Michael Clark and the group East of Shirley. The piece is titled Ernesto Mañana, copyright Michael Clark and Tintype Tunes in 2008, and used with their permission. I hope you enjoy. By the way, you can also subscribe and listen to Franklin Matters Radio on your favorite podcast app. Search in podcasts for Franklin Matters.